Good morning, DSTT community. This morning we're going to talk about stretching the hip flexor, as well as getting a little bit of a quadriceps stretch through the front of the thigh. If you received our morning email, a lot of the stretches that were in there were addressing the back of the thigh, the back of the hip, the hamstring. And so we want to kind of give a full picture of how to keep your hips healthy. We do a lot of walking. Some of us are runners. We do a lot of sitting, and those types of movements are single plane movements where we are shortening the hip flexor muscle at the front of the hip, especially if we're sitting a lot. So that muscle can get very tight, very inhibited as well. And so when that gets tight, it tends to tip the pelvis forward, which can put a lot of strain on the low back. It can increase that lumbar curve further, which can compress the vertebra and cause tension and pain. We want to make sure that we balance out the pelvis. As we do more sitting, more walking, sometimes also the glutes can weaken. So we want to make sure that we're keeping the back of the hip, those big strong muscles, strong and healthy, so that way we can keep our pelvis in a more neutral position, which will keep our core stronger and our back in a more neutral position. So we're going to talk about the wall stretch or the couch stretch today. And one of the big important things when we're doing these types of stretches, especially for hip health, is to understand that the hip is one of the largest joints in the body, and it does a lot of work. It supports the whole upper half of the body, the torso, your arms, your head, and your neck, and it does a lot of work. But it's also a ball and socket joint. So oftentimes while we're sitting or walking or jogging or running, we're moving that joint in only one plane, where when we can work in a Pilates environment, even an aqua environment in the water, we can move the hip, move the joint through its full range, through different ranges of motion, different directions, which is really good for hip health. The hip is probably one of the #1 most common joint replacements in the United States, and there are some studies that suggest that by 2030 we will see an increase of 174% in needs for hip replacements. So keeping this joint healthy and happy is very important, not only for the health of the hip, but also for the health of your core as well as your back. Now, if you cannot go down on your knee, put any pressure on your knee, even if you have a pillow or a pad, you can do this one standing in more of a standing lunge position. Otherwise, we're going to show a modified version without an increase in knee flexion, and then we'll show the wall stretch as well. Now, with any exercise or stretching routine, you're going to want to check with your doctor and or your physical therapist to get clearance from them to make sure that nothing that you're doing is contraindicated for your body specifically. So let's get into that hip flexor stretch. So as I said, we can do this one standing. I'm going to stretch the left side, so we're going to step that right foot forward and we're going to drive the hip forward. And as we're doing that, we want to keep the rib cage knitted in, we want to keep our core tight, and we want to activate our glute to keep our posture in a nice clean position so we can create that length through the front of the quad and through the hip flexor without arching. We really want to keep that line and keep our core active and engaged. Now we can drop that left knee down to your pillow or to your pad. Feel free to dorsiflex the back foot if you tend to cramp. Otherwise, resting the foot on the floor is fine. Once again, we're going to stack. Shoulders are packed back and down. Spine's nice and straight. We're going to knit the ribs in, draw the abs in, activate the glute, and we're going to drive forward. So we're getting into that quad and that hip flexor. Bringing ourselves back too much to this position tends to put a lot of pressure on the low back. So keeping that strong active core as well as your strong active glute is going to keep the pelvis in more of that neutral position. Keep your spine in neutral while also strengthening your core and your glute. So to set up for the wall stretch, now If you have joint replacements in the knee, most likely this is going to be contraindicated because of the amount of knee flexion required for this stretch. If it's too much on the knee, you don't have to place the shin and the shin, right up against the wall. You could keep the knee farther forward, but it does decrease the stretch a little bit. So I'm going to start with my right side. I'm going to put my right knee down, and I'm going to pivot, placing the shin and the foot of my right leg right up against the wall. So I'm in deep knee flexion on my right leg, and my left leg is up. Now, a lot of folks are not able to get up into this position with the opposite leg up in more of this lunge position. Oftentimes we have to keep this leg down on the ground. Once again, just as the standing and the kneeling version, we are going to engage our core, activate the glute, and we're going to lean forward. We're going to drive that hip forward and towards the floor, down and forward without arching the back, keeping the core tight, keeping your glute engaged. You can also add an arm overhead for a lateral stretch to increase that. If you need to modify this version, you could pull either the knee forward away from the wall, or also bring your left leg forward and down and drive the hip forward. You want to really baby step into these specific stretches for the couch or the wall stretch, because you don't want to get into a position where you're going to tweak something or hurt yourself moving into a position that your body's not ready for. So baby step it in. Start with your standing version. Try it with the knee down. Then start to slowly get into that wall stretch, maybe starting with the knee forward and the foot against the wall, and then slowly back that leg up so you can increase the tension. Okay? Thanks so much for joining me today. More to come tomorrow, both in video and in your inbox. Thanks so much, guys. We'll talk to you soon.